Hi, everybody. Week 11 is upon us, and you're getting closer and closer. After this, you have one more course to go, and you are done. So, I'm sure that you're anxious to get going. Let's see what we have in store for us week 11. And you have your final coming up, and you have your final review coming up. Okay, so let's look at our overview. Bone disorders is what the topic is going to be this week. And we see this in children because in the childhood area or period, so much growth is taking place, primarily in their bones, long bones. They're constantly reshaping and remodeling, so it's not terribly uncommon to see issues with bone growth and development in this population. They also are very active in sports, so we see a lot of injuries, broken bones at this time. Bone disorders can be caused by injury or cancer. They can be inherited, occur as part of a child's growth, or occur from no known reason. Some can cause pain, difficulty walking. Others can cause no symptoms. So providers base diagnosis on a thorough history, close observation, and examination. So I'm trying to teach my students in earlier courses of the incredible benefit of obtaining a complete history on our patients. We can learn so much information by listening and asking those questions. So children's bones are growing continually and reshape or remodel themselves extensively throughout childhood. Growth proceeds from a vulnerable part of the bone called the growth plate or epiphyseal plate or physis, and it is the area of growing tissue near the ends of the long bones in children and adolescents. In remodeling, old bone tissue is gradually replaced by new bone tissue. That's called remodeling. And many bone disorders come from the changes that occur in a growing child's musculoskeletal system. These disorders may get better or worsen as the child grows. Other bone disorders may be inherited or occur in childhood for no known reason. So our objectives are the same that we see every week, except they're focused on the musculoskeletal system, and you have readings as well. Now let's look and see what our clinical practice scenario is this week, because it's a little different. Our clinical practice scenario for week 11 is in regard to safety concerns. So think of a safety concern that you would require action by you and list a few examples of safety concerns. Where would you find resources for what you should do, ethically or legally, and how do you find out what needs to be reported? What would you do if you were concerned but it wasn't actually illegal or reportable? How would you discuss this concern with the parent, or would you stay out of the situation? What are your state requirements for telling parents if a minor is sexually active or doing drugs or other behaviors that parents might want to be aware of? Do you need to tell the parents? Should you warn the teenager about what will show up on the insurance bill, or should you approach these sensitive conversations at all? So you have 4 questions that you're going to be answering, and you can answer those 1, 2, 3, 4. It doesn't need to be written out as a essay or anything of that nature. However, I do want to make sure that you are following APA format in the use of citations and references, and that you are using standard English grammar. All right? So let's see. One thing, too, I wanted to double check, too, to make sure that you all know where this is located, so there won't be any discrepancies in your looking for the review. So the review will be held Thursday, May 10th. That's coming up at 7 p.m. I don't have my calendar in front of me. And, not that one. I'm looking at the wrong link. All right. And you can get there by clicking on this link. You'll enter the room Bloom. There will be a drop down. One of the rooms is Wiggins. I can't remember what the other one is. But you'll go into the Bloom room and use the following password, student. Dr. Blackman is going to be performing the final review for everyone, and she will be recording it for those who are not going to be able to attend. So keep going. You're doing an excellent job. We've learned lots of information on the clinical reports that you've been doing every week, and I hope that you are abiding by my suggestion and keeping a notebook of treatment modalities. I think you'll find it very beneficial as you finish up and enter into practice. And good luck, and I hope you have a wonderful evening.